So this is what we've been waiting for months here at Dr. Wendel's office. We have Volux, which is the newest filler on the market in the United States. It's been in Canada, Europe, and Brazil for several years, but it is a hyaluronic acid. It's in the Juvéderm family. It's called Volux, and it is tailored specifically for the jawline. So it's the only hyaluronic acid filler that is FDA indicated for treatment of the jawline, which is all the way through here, all the way down into the chin. So we are so excited. So for everyone that's looking for that very defined, contoured, precise, beautiful jawline, we now have the tool that we've been waiting for. So I want to tell you a little bit about it. There are terms, scientific terms in this. There's G-prime, cohesiveness. Then we talk about the ability of products to hold water or pull water, if you will, or hold on to it, to not do that, because there's different areas where we like more water and lots of areas where we don't want any. So this product is a very high G-prime, which means it's more firm, which sounds really terrible when you talk about your face, but it's still malleable, and it has a lift capacity that is much higher than any product we have. The reason that's important to us is because we're talking about the jawline, and if you think about masseter muscles that sit here, that's what lets us chew. They're pretty big, strong muscles for the face, and then all of our normal underlying tissue of the skin, and then thicker skin here. So we need to be able to lift everything out and have it hold. That's what gives us that beautiful shaped and contoured jawline that we're all looking for. I want to talk about longevity of the product. Our study in the States was followed to a year. So we know that for a year, this is going to hold up and it's going to look great. I just left a meeting with an international panel of speakers to include Brazil, several European physicians and Canadians, and there are published studies where it was followed for 18 months. There is a significant improvement still in the jawline at 18 months post-injection. We're excited to tell you that we are one of the first practices in Tennessee to have Volux in our hands. I do training for the company that makes Volux, Voluma, Volbella, Botox, so that's Allergan, and that allows us to have early access to anything new coming through the pipeline. So we're very excited to bring it to you because we've been waiting for months to create jawlines that we love. So just for an example, I want you to get to see what we see and pretend it's under the skin. So this is Voluma, which we've been using forever for cheeks, chin, which is FDA indicated, and it's still something that we'll use through this area. And we've been creating jawlines with this, but now we have the correct tool. But I want you to see, so if I extrude Voluma, you can see, usually it's on a darker background better. So slow extrusion, and it stays together, and then I can make a mound sort of it, and it kind of flops over. So now, if I take Volux, it's like it starts making a wall and it stands on itself. So this is called rheology, and it's really the characteristic of the filler. And look at that. So you can imagine, and actually I can tilt this and it stays. Just so cool. And if I try to make a little mountain, it stays as well.